Welcome to Fresh Outlook. I'm Frank Cipolla. Coming up this week, the worrisome Ebola outbreak. It is marching through Africa and causing concern for the world community. So how did it get this bad, and what are we doing to combat it?
The World Health Organization is urging world powers to act quickly to control the Ebola outbreak in West Africa.
We need a well-coordinated mechanism bringing together the countries affected, as well as development partners from other countries, including USA.
The U.S. Centers for Disease Prevention and Control in consonance is also calling for urgent action.
There are three key things that we need. The first are more resources. The second are technical experts in healthcare. And the third is a global, coordinated, unified approach.
And President Barack Obama has sounded a note of caution as well.
Stopping this disease won't be easy, but we know how to do it. We can save lives.
In the U.S., a third aid worker has contracted the virus. The Boston area doctor was not caring for Ebola patients, instead delivering babies at a missionary group's hospital in Liberia. Meanwhile, in Northern Democratic Republic of Congo, the total death toll has risen from 13 to 31. While Nigeria has confirmed a third case of Ebola, bringing the total confirmed cases to 17. Elsewhere, the Ebola epidemic has triggered a food crisis in West Africa, and help is on the way. 65,000 tons of food will be given to 1.3 million people affected by Ebola in 3 months.
Now, joining us to discuss this in studio is psychologist Dr. Bart Rossi, the political psychologist Dr. Bart Rossi. We're also joined by Republican strategist Dee Dee Benkie, who worked for the second President Bush in the White House, and Ebola expert and activist Yasmin Sheriff is joining us via, D.C. Bureau, actually. There she is right there, and via Skype. Adia Benton from Brown University, and also Professor Chuck Williams is here as well. We have a big panel here to discuss all of this. The first question out of the box is, it seems to be getting worse in Africa and seems to be going from nation to nation in Africa. The World Health Organization, or Doctors Without Borders, says that this is an international crisis that has not been addressed. Have we been doing enough?
I think we have, actually. I think we're trying hard. To combat fear, as a psychologist, I always say you need best communication. And I think we're going down that road of better and better communication and dealing appropriately with this outbreak.
Let's throw it to our guests who are there via Skype and also in our D.C. Bureau. Have we broached this subject enough? Is it in the news enough? And are we doing enough for it, to combat it?
Well, I can answer that question. I think that perhaps we haven't had enough, perhaps there hasn't been enough a lot of fear in the States, but there certainly is a lot on the ground in Liberia, Sierra Leone, and Guinea, because the response was inadequate and slow. And there actually isn't a coordinated response, or there hadn't been a coordinated response when it should have occurred in March, when the first few cases were actually identified and that there was an outbreak identified.
Well, people look to the United States to lead often in the world, and here is a situation in which it's clear basically to everybody that maybe Africa can't handle this just yet, or doesn't have the wherewithal to do so. Are we doing enough, Dee Dee Benkie?
Well, actually, I think we need to follow President Bush's lead, because a lot of people, they do not appreciate President Bush in all areas. But this is one area where all Democrats and independents, everyone, they agree that he gave billions of dollars to Africa. And I think we as a country, we need to go ahead and do that, and do it early on to combat this terrible disease. So if we could send a lot of money, and it has to be a good amount or it's not going to work, to Africa, I think that's something that we can do that would be very important.
Professor?
Well, I think that, along with what my colleague mentioned with President Bush, he gave so much in terms of resources to Africa. It'll be one of his crowning achievements, in my opinion. But as my colleague at the CDC mentioned, we need resources. So when President Bush gave the resources, then I think it hits on what's important about this. We can't affect these global challenges, these medical epidemics, pandemics, I'm not an expert on that, if we don't have resources, and that's just the reality. So I think one of the things people can do if they're concerned about it, I don't know if fear does any good to anybody as a psychologist, you can help. So for example, you can donate to Doctors Without Borders as a way to support this effort to eradicate or to treat the Ebola outbreak.
All right, let's go to DC Bureau, and Yasmin Sheriff is on the ground. She's seen a lot. She's been there. Tell us what you have seen in your travels.
I live in Freetown, but I have lead an organization, a women's organization that has many members living within the quarantine area, and I'm in close communication with them from Freetown and even here in the U.S. And I think what we have seen, what they're telling me that they have seen, is that they have seen a government and perhaps an international community that wasn't prepared for this outbreak and didn't really move fast enough to respond to it. They have seen that they, as the community, people on the ground, haven't really been kept fully informed and told really what was going on. And I also think that perhaps, although there's huge amounts of money being spent, the communities themselves, ordinary men and women, aren't being particularly empowered to help themselves during this crisis.
Are there any misconceptions with regard to what's happening in Africa? In other words, are people not addressing it as seriously as they can because they believe it's in Africa and it's a government there, and there's lots of governments there that are just not responsive?
Well, I mean, from listening to the news and reports here, while I'm here in the U.S., it seems that that may be a problem, that people maybe feel that there is some kind of overload and fatigue because, you know, every time in Africa it's just problems, 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 and there never seems to be solutions. The government never seems to be doing enough. I think that perhaps the international media and the international community ought to turn their attention and look at what are the people at the epicenter of this epidemic doing to help themselves. We have to remember that the people in the Kizzy Triangle, where the three countries of Liberia, Guinea, and Sierra Leone meet, where this epidemic has started, are people who are just coming out of almost 20 years of brutal civil war. And they have made huge strides in getting their lives back to normal. And now suddenly, because of lack of resources to address fundamental questions like, you know, the basic healthcare system, a basic public hygiene system, problems of governance, of accountability, they are now faced with having to deal with, you know, a problem which the West is only concerned about because they think that it's going to be exported back to them by airlines and in other ways. So I think that the media should really, it's very hard to say that there are good news stories, but I think there are many, many things that ordinary women and men in their communities, within the countries, are doing to work and remedy the situation with regard to Ebola.
All right, let me stop you right there for just a moment.